the clinician well-being team rounding on the unit, not just sitting in one place saying, come to me, but going up to individual people and checking in with intentional, like, how are you? What does your day look like when it's good? What could make your day better? I think that was a really big piece in us figuring out, I think those quieter folks, those people that maybe feel like they'll never be heard because they were.
Welcome back to Tell Me Why, a podcast about and for the healthcare workforce. I'm Emily O'Sullivan, and I'm joined with my co-host, Jen Wright. And today we are diving deep into what it looks like to move beyond just wellness perks toward true organizational transformation. And we're thrilled today to welcome Dr. Whitney Marvin and Dr. Alyssa Rheingold. We've had the privilege of working very closely with these ladies over the past 3 years on a grant that SCHA and MUSC received from the Duke Endowment, an investment that has been a really important catalyst for this work. And together, they've been leading a massive multi-year project aimed at improving the healthcare employee experience through an innovative blend of culture shifts, operational changes, and unit-based support. We've invited them today to discuss how layered evaluation and comprehensive listening strategies are helping us understand and address the root causes of workforce distress. Whitney and Alyssa, welcome to the podcast.
Thanks for having us.
Thanks for having us too.
Well, we have really been looking forward to this conversation, and I know that so much work has been happening specifically in the last 3 years, but obviously there was a lot of momentum happening before that to get MUSC and your team to a state of readiness to accomplish all the things that you have in such a short period of time. But before we get into the data and the mechanics of the initiative, we always like to start with why. So we would love for each of you to share your personal and professional past that drew you to the specific work in healthcare workforce well-being. And additionally, how does your why connect to the responsibility that you all feel toward the people of the front lines? And why was that important that you frame this project as a core organizational investment rather than just another clinical study or project? So either one of you can start, and we'd love to hear from you.
Yeah, well, great. I guess I'll start. This is Alyssa. So I'm a clinical psychologist, and trauma is my area of specialty. So I'm a researcher, clinician, and educator in the area of trauma, especially early intervention strategies to foster recovery and resilience after trauma and large-scale events. And my sort of parlay into this space of workplace well-being occurred at the start of the pandemic, when I kind of recognized the pandemic was definitely going to be a collective trauma for our healthcare workforce, and wanted to do something to bring my knowledge and expertise to folks within my own institution to support them and hopefully fostering recovery. And reached out within my institution about what are we doing, and there really wasn't anything organized. It was the traditional, well, we have EAP if folks need it. And there wasn't a proactive approach to kind of see how can we step into the space of our healthcare workers and figure out what their needs are and to support them. And so I sort of naively, thinking it was going to be several months of like volunteer my space and my expertise in the space, stepped in and realized that well-being for a healthcare workforce was so much bigger than just the pandemic. And the pandemic, I think, highlighted and exacerbated what those issues are, but there was so much more there in this space that needed to be addressed, both in our institution and then just nationally. And just felt the obligation to stay in this space until our institution really had a good organizational structure in place. As you said, it's not just sort of a one and done, or not just a study, but like what is the true strategic and larger approach to addressing this issue and well-being. And so sort of remain in this space. Research evaluation is also my area of expertise. And so bringing that lens to ensure that we're really paying close attention to not just doing something just to do something, but that we're paying attention to what we're doing is really what is needed and what actually makes change. So that's sort of my professional interest in investment. And then, personally doing trauma work, I've always have had to be very intentional about taking care of myself and my team and our approaches in where I work, just because trauma is such a difficult space to be in. And so I've just, personally am very invested in just the practice of my own both individual and team work in this space. So yeah, a little
Sounds
bit
like you
about
were
me.
made for this work.
Yeah. Uh, yeah, and I love meeting other passionate people doing this work too. So I've really enjoyed. Whitney and I did not know each other before this project, and we have become very, very close friends. And I just value her work and her personally. So
Yeah,
I'll
it
hand
goes
it off
both
to you.
ways, friend. I think, yeah, we've been so fortunate with both of our backgrounds. So Alyssa's a clinical psychologist. I'm a peds critical care physician. And, I will say that really throughout training, you get taught. I was initially from this kind of old adage that like you just kind of put your head down and you work through it. And, I started working as an attending here was my first job out of training and realized that seeing hard things at work and doing hard things at work. And I work in nights and weekends and, unfortunately take care of quite a few patients that die. Seeing that impact on not only myself, the trainees, the staff, everybody who is taking care of it, and even the patients and their families, right, that are getting impacted by these. I think it was my first couple years of training that I said, we need to do something else and figure out how we're going to take care of each other and do this better. And so that's really where my initial kind of like love and passion started and, started kind of working with trainees in the GME world and then bridged it out into our department and then was really thankful when this opportunity came around to work with Alyssa and you guys from SCHA and be able to really just broaden our depth of kind of evaluation and interventions that we could offer. Because I think the one thing we were realizing that, I'm in this kind of insulated ICU world, but as I go to different units to help out or I'm on different committees, I'm realizing that, different areas have a very different needs. And so, what are their stressors are going to be different than mine? And how, as an institution, can we help all these different people and meet them where they're at and really build this, thriving and sustainable and really joy-filled workforce? And so that's why that's my why, I am. I always say that like I have found a lot of like power and meaning and passion in this our institution's support also of this effort. And so I just feel very thankful for that and everything that we've been able to accomplish. And I'm looking forward to everything that we get to continue to do in the future too.
Right. Well, MUSC is, and all of your colleagues are certainly blessed to have you all in their corner.
So as our listeners know, our why framework is based on the Surgeon General's 5 essentials for workplace mental health and well-being. And the center of that framework is elevating worker voices. And you have done a fantastic job of prioritizing that at MUSC. Throughout the grant, you've made some really impressive systemic changes, but it started with implementing a comprehensive listening strategy and truly through multiple modalities, listening to the needs of your workforce, assessing those needs, and you really took the time to gather all of that information before you created your strategy. So can you share a little bit about how you identified and prioritized strategies that were meaningful to your frontline staff? What are those ways that you listened to your workforce? And also ways that you have evaluated what's working.
Yeah. I think that just kind of piggybacking off what I said is, we were so excited when we got this opportunity to collaborate with you guys. We're like, okay, let's just talk about all the great things we're going to do. And Alyssa very astutely was like, pause, like we need to figure out what we need before we need to like go at this systematically from an evidence-based standpoint before we go and just start doing stuff to see if it works. Right.
Mm-hmm.
And I think that's where we realized that we need to listen. Right. And so how are we going to listen? And being able to partner with you guys and utilize that workforce experience survey during our first year of this grant was really helpful. The one quantitative stuff information we got from it was great, but it was actually the free response qualitative questions that were so powerful. The thematic approaches that came from that and just some of the quotes too are still getting continued to be used when we present information about some of our themes that have come across and where we've put our resources and interventions. From a care team member standpoint, we spent some time collaborating with leadership on figuring out, you know, we would have loved to listen to every person and given an opportunity to listen to every group at MUSC. It just is not going to be feasible. So we tried to get a diverse representation of clinical areas and some non-clinical areas and do some dedicated focus groups. So from like women medicine to pediatrics to adult ICUs to adult acute care floors and even emergency departments, and spent time with the people that are at the bedside, right? So the nurses, the RTs, techs, and even some of their leaders in figuring out, what opportunities there are and some of their pain points, but also spending time on what we're doing well. Like, what does a good day look? Leaning into some appreciative inquiry, what does well-being look for you guys? What are some of those that we can build off of? So I think that was a really powerful thing, just spending time with people in those focus groups. I don't know, Alyssa, if there's anything else you want to add to that piece.
No, I mean, I think just taking that time is really important. And, we were a little, I think, overambitious, or just ambitious, maybe. I don't know. We were going to just do a few focus groups, and we actually ended up doing, I think, 16 focus groups because we also really wanted to hear from different types of professions within that. So we had some focus groups that were specific to our attending physicians. We had some focus groups specific to our trainees, our residents and our fellows, and some that were specific to our nursing care and other healthcare worker communities. And they all had some overlap, but some different identification of needs. And I think that was really helpful too, to really distinguish what are the different needs, both within the different units and work groups, but then also within professions, I think is also was important, and transcribed and really used that to guide kind of recommendations. But also, I think the other really important thing that we did with those listening sessions is we reported back to the people that we heard from. And I think that was really important because I think sometimes people feel like when they give voice or give thoughts that they feel like, is this really are you really hearing and are you really making change? And we were intentional about going back and reporting back. This is what we heard from everybody. Does this sit, and then it was iterative feedback. Does this sound like, this is correct? Are we missing things? And I think that process too was not only in the information gathering, but it was also, we were already starting to implement and changing culture by doing that. So the process of gathering and hearing people, is that process in of itself is an intervention.
Absolutely.
And so I just want to highlight that.
It was also just really cool. I'll add in that when we went to share back, we had already garnered our data from workforce experience. We garnered some of the focus groups. We presented it to our leadership council and actually had already hired a chief wellbeing officer. So when we went to do a lot of our feedback about where we were, we did it with her. So she came individually to every unit, help talk about her strategic plan, like what she's going to help build with the thanks to like what they put in. So that was like also a very cool way of not just saying like, hey, thanks for info, we're going to do things, but like, look, we have hired somebody who has a plan and we're building.
It's really impressive. That closing the loop we hear so often is so valuable to help people trust that the organization is going to do something moving forward. And even if that feedback is, we hear you, and right now we don't have a solution, we'd love to hear if you do, but we just want to know, we want you to know we heard you.
Yes. Yeah.
Absolutely. Yeah. Kind of Peggy. Sorry, go ahead.
I was just going to say, brings up another, I think, interesting thing, Jen, that you just mentioned, is not only gathering feedback on like what are the pain points and what are the barriers, but what are their recommended solutions, I think is really important information to gather. We did that both on the survey and in our focus groups and got really great ideas. And so I definitely think, as if another institution's thinking about really doing a deep dive, is not just hearing what are the issues, but like, what are the solutions? Because there's some really great ideas that some of our healthcare team members were recommending. that were embedded in our larger strategic plan.
Absolutely. Yeah, kind of piggybacking on that. Have you learned anything about the link between an employee being heard and their decision to stay within the organization? Have you seen that play out at all over the last few years?
I think that I mean that's a bit of a hard thing to do from a big scale, but
Mm-hmm.
we have had a lot of anecdotes that we've had from people that have engaged in some of our resources. And in fact, there's one that comes up to mind very recently of an employee that actually took our stress first aid training. So was learning about stress first aid, how to identify stress in themselves and their team, and when they took stress first aid, had actually put in a 2-week notice at our institution and took stress first aid and said, you know what, like I believe in this and I believe in my team and I believe that in MUSC, who's putting the power behind this, rescinded their notice and actually reached out to our manager of stress first aid and asked to become a trainer um, and a peer
Wow.
supporter and wanted to be somebody that can advocate and champion for this. It's moments like those that I'm like, people, I think they feel heard and they are finding that
Mm-hmm.
tie to connection too.
That's amazing.
Absolutely.
Yeah, and Whitney, I'm not sure if you mentioned this, but I know both of you alluded to the fact that you had selected certain pilot units to really intensively focus on for this work, that you did focus groups with and listening sessions with. Can you talk a little bit about how you identified those pilot units, why you decided to target those?
Yeah. So it was a collaborative effort with leadership, and we did not want to just pick, high performing units. Our idea was to pick, units that hopefully we could assist in making change. So we looked at our Press Ganey scores for those teams. And I took a handful of them and sat down with some of the leaders, both at Children's and in the main hospital side, and asked them for some input, with a goal of saying, a diversity of clinical areas and of teams that would be open, to being a part of like kind of the pilot team. So that was really how it came down to, and then really it was, overall lower functioning teams, but the diverse patient experience was a big important piece of it.
So we've mentioned this a couple times, not directly, but we're kind of talking around it, this issue of burnout. And we know that burnout is not just a resilience issue. It's a systems issue. Obviously, the key component of your strategy is unit-based support. So in your experience leading this initiative, what are maybe the top 2 or 3 systems drivers that are contributing to burnout that you've identified in those listening sessions or evaluation efforts?
Well, I'll name a few, and Whitney might have some some others to add. I mean, I think what we heard was this sense of lack of organizational support from leadership or from the broader of feeling, kind of isolated and not having that broader cultural organizational support, whether that looks in like hearing whether the staffing needs may be for that area, whether it's appreciation, so is that organizational support. Work design kind of came up as well. So this, that's stepping into the efficiency of practice work, of what kind of that workflow, what are the things that get in the way of that makes my job harder to do. And some folks also mentioned just knowing what the resources are, knowing what are if I do need mental behavioral support, if my family needs mental behavioral support, where do I go to? What are sort of those resources? And just being able to talk to somebody who understands, it doesn't have to be like mental health support, but just talking to other people that kind of understands what I'm going through. So kind of that peer support and that group support, I think, is also sort of came up for folks.
Mm-hmm.
But yeah, I don't know if there's other things that kind of
No,
we
I
heard
agree.
that.
I think it's so interesting because it really does just like tie back to the like triad of, efficiency of practice, personal well-being and culture. And, as I'm still very heavy clinical in clinical medicine. And so, some people heard some of these results and they're like, oh, wow, this is so surprising. But I think anybody that's kind of in the thick of it in the weeds are kind of like, this isn't, unfortunately, that, not everybody's able to work at the top of their license because they're dealing with certain administrative tasks. So, but yeah, no, I think that Alyssa hit it. It just, everything kind of ties back to those three main areas, in one way, shape, or form or another.
Definitely. And Whitney, the triad you mentioned, obviously the professional fulfillment piece of that. And for our listeners, some of you may be familiar with burnout and professional fulfillment, but if you aren't, one of the things that we're finding from especially the repeat distribution of the workforce experience survey, which includes Stanford's professional fulfillment index, is just because your burnout is decreasing doesn't mean your professional fulfillment is increasing. And so it's important to pay attention to both pieces of that. And a lot of evaluation efforts are doing a much better job of trying to get at burnout and drivers of burnout. But the other side of the coin of that is that ability to thrive in your work and the ability to connect and really be professionally fulfilled. So I'm wondering if either of you personally have any experience with that, or any of your colleagues noticing that, professional fulfillment is a good thing to pay attention to as well.
Yeah, absolutely. I mean, this is some of the work that I kind of do in just my regular day job, not in this space, but just doing trauma work and just paying attention to what my values are and what's important to me. And really, that's for all of us, even both in the work and our personal life, is really important to do, is really to pay attention to what matters to you and making sure we're intentional about doing the things that matter and paying attention to that each day. So it's kind of really focusing on that for me, and making sure it's very present in your life. So for me, and every year kind of reflecting on what it is, right? Because as we change and we grow professionally, and so what matters to us might shift and change. What mattered to me now might be different than it was 5 years ago. And so for me personally, I'm constantly each year kind of reclarifying what matters to me and what fulfills me at work and what gets me up in the morning. It is not my email inbox, right? But but what is it? And then how do I reframe some of those things to know, well, that is part of that. So for instance, right now, my value for this year is that one of my values that I'm really focusing on is curiosity, approaching my patient care, approaching my colleagues, approaching my workspace with curiosity really helps shift how I approach the work that I do. And it makes it more fulfilling versus then if I don't approach with curiosity, I might lean into a more negative mind space or headspace. And so just being very intentional about that then enriches, and I get a little bit more fulfillment in my day-to-day work. So that's kind of, for me personally, kind of how I've
Yeah,
approached it.
love that.
Yeah, I'm gonna like take this back to I think my kid. So, also just people I think tend to gravitate towards the negativity, which is talking about the burnout piece, right? And so I think just working on the positive aspects of it, which I think of that as more as professional fulfillment. Like just because I'm not burned out doesn't mean like I'm not happy in my job, but focusing on the positive aspects of my job about, what do I and the people that are, at the bedside or not even at the bedside, but what do you find joy in at work and how do we find more of that? And so I think that's kind of how I frame them sometimes. I've done a lot of like kind of positive stuff. I've got 3 kids and my middle like just thrives off of, positive interactions. So we use a lot of kind of positive based therapy techniques with him. And so I kind of almost think of it like reframing things like that about, how do we find joy? How do we increase joy? What is going well? And how do we build on those things? Because there's a lot of people that I think are not burned out, but they're not fulfilled. And so, how do we support those people and not just let them fall in the middle, right? So,
Right.
how do we, garner their interests and garner their what gets them excited, and build from a team standpoint on those things.
Yeah, definitely. I love that insight. Love that you can learn from your children interaction as well and really make that apply to the rest of your work life. So, kind of going back to that initial kind of unit-based strategy we started talking about, how is the approach that you all took helping you dismantle some of those drivers at the unit base, where you're not putting the burden of coping on the clinician, but you're really kind of building a system around them that supports them.
Yeah, I mean, I think this is culture change, right? So I think we're trying to teach people and encourage people to say that it's okay to not be okay. And you see and do things that are very not normal to a lot of the rest of the world and the population. And so really trying to normalize help-seeking behavior. So we have, our goal, I would love to say that we're going to get everybody trained in stress first aid as a basic level of knowledge about that. And then we're really trying to build up and encourage people to utilize our peer support program and kind of working hand in hand with them as our clinician well-being team. So the first level of support ideally is going to be a peer to be able to check in and say, like, how are you after an event or, something that happened or something that you're dealing with. And if that seems like it's not enough support, then, turning over to our clinician well-being team or EAP. But so much of this is just culture change. We're really trying to be open about asking leaders to be open about this too. And, being able to share stories about, say, hey, like these things have happened to me and this is what I've done to deal with it. And, this is when I utilized peer support and this is how it helped me. And some of that is, just modeling. So that's a big piece of this too.
Definitely. And actually, that leads me into my next piece of curiosity, following it in Alyssa's footsteps. So in the current healthcare climate, we definitely need to talk about things like protection from harm. Protection from harm, we know, also includes psychological safety. And what I'm hearing you say, Whitney, and also Alyssa, is having this layered evaluation approach and having the vulnerability of your team and leadership coming and saying, we want to know, right? We want to hear from you, good, bad, ugly. Otherwise, let's do this. So I'm just wondering, in your approach, were there specific tactics you were using to elevate the voices of maybe the quiet ones or even the dissenting ones, right? That are like, oh, we've been through this before. This isn't going to change anything. How are you making sure that they're feeling heard also?
Well, from my standpoint, I think having a multimodal approach to gathering input is really important. So just doing it in one specific way, I think you might miss some folks. And so I think taking that both using the survey, so that's one way we're able to gather people's feedback, which was anonymous, doing focus groups, so getting groups together to get their feedback. But then we also our well-being clinicians also went often and did rounding on units on a regular basis so they could just get to know and create relationships with people on the units and then have one-on-one conversations. So they intentionally sought out feedback in that regard and then would bring a lot of that feedback back to the group. And so just taking that sort of multimodal approach, I think, was really helpful to make sure we captured not just the noisiest or loudest person, I should say, or most vocal, but that all voices were able to be heard, I think was really important. And then again, bringing that and highlighting some of those quotes, some of the ugly quotes we highlighted in our presentations. And so I think that was really important because I think people saw, okay, they're willing to say what the actual issues are and they're willing to put that out there. And leadership is willing to hear it. And I really think that whole process has shifted culture significantly. I mean, just having that shift to now we have a whole center for workplace well-being at MUSC is so huge and that came directly from those voices. It came from those quotes. That's what shifted. And that's really kind of what drove some of that.
I was just going to say, I agree. I think that the clinician well-being team rounding on the unit, not just sitting in one place saying, come to me, but going up to individual people and checking in with intentional, like, how are you? What does your day look like when it's good? What could make your day better? I think that was a really big piece in us figuring out, I think, those quieter folks, those people that maybe feel like they'll never be heard because they were.
Yeah, it's so important to be intentional, I think, about drawing out that feedback from your people that don't tend to speak up. But then equally as important as what Alyssa was saying is not shying away from those difficult to hear comments, that negative feedback that's hard to hear, especially for leaders, just really leaning into that and not shying away from it and shining a light on it, because that's really the only way to make it better. So you've touched on this a little bit already, but you've made some really major systemic and like infrastructure changes over the past 3 years. You've mentioned hiring the chief well-being officer, creating the Center for Wellbeing. I know you've hired lots of other folks within that center. Are there any other infrastructure changes that you would want to highlight for folks that you've made over the past 3 years? And then could you also just talk a little bit about the importance of having that support at the C-suite level, having that chief well-being officer, and just how important that was for making intentional strategic changes that really trickled down throughout the organization?
I think that, when you talk about well-being, again, just knowing that this is full scope well-being, right? That is what makes having somebody that is at executive level meetings so important. So,
Mm-hmm.
when they're talking about changing meeting structure, which some people say that's not well-being, but actually it is. So,
Mm-hmm.
why don't we say we're going to change our meeting standards to 25 and 50 minutes? It allows for bio breaks and some breaks and personal time between. So you're not backing up. Like that's well-being. But
Mm-hmm.
some people I think may not think of it like that. We're able to accomplish that and partner with other people or with other areas in the institution because we have somebody at that level. Some of the huge wins, I think we have a manager that's running our efficiency of practice that is under the Center for Workplace Wellbeing. Again, some people are like, wait, why are they not in quality? Why are they not in another area? We're like, no, because this is well-being, right? Getting
Mm-hmm.
the pebbles out of your shoes, that's, impacts a lot of people's day-to-day jobs and their job satisfaction as well. So I think that's huge. And then another, I think, really big win from our group too is that we have a dedicated director for GME. So also acknowledging that all of our trainees really have very different stressors and needs than a lot of our other population. And so being able to hire somebody that's part of our team that is dedicated to them solely, I think was also a huge win and something that we realized. And part of it came from, our data saying that like these people have a different approach that we need and to be able to meet.
And then one other piece I think is really important is integrating a system of gathering all the information. So sort
Mm-hmm.
of a more organized
Mm.
approach to collecting data and information, I think is really important because before we really didn't have that. It's sort of hodgepodge. And sometimes people just lean on one type of data point, like, you know, press scanning is fantastic and it offers a lot of good metrics. And it shouldn't be our only data point when we're talking about well-being because it can impact lots of different things. So creating kind of an evaluation and data collection system, I think, is really important as well. And I think that's something that we've been able to do over the past couple of years to be able to demonstrate what's working, what's not working, what we need to change, where we need to go.
And I think one of the really cool things that I'm hearing that it did for you is it allowed you to take both a systemic approach and an individualized approach. And I think it's really hard to marry those two, but both are so important when it comes to being impactful and doing meaningful work. So I think that, that's one of the shining points of how you all approached it is you were able to make true systemic impact, but do it from a way where we're talking about how it impacts the individual within the system.
Yeah.
Yeah. And also,
Yeah. I mean, it starts from the individual and the individual's voice, right? That's where it
Mhm.
starts. But
Yeah.
but taking that and making that organizational system culture change.
Yeah, and you used all that data that you collected through the system you put in place to create your strategic plan, right? Is there anything that you would want to talk about in terms of the strategic plan and kind of your process for how you created that and how it's driving all of your efforts?
Yeah. I mean, I really want to commend our chief wellbeing officer at the time, who really kind of was the one that pulled all of that information together. I mean, we kind of, we keyed it up as far as here's all this data and great information. Now do with it. So Heather did a wonderful job of sort of then taking that and then really fine tuning that strategic plan, which included sort of fostering, continuing that foster that culture of well-being, focusing on kind of that joy in the workplace, right? That we talked about a little bit. How do we destigmatize help seeking behavior and protecting from harm? developing an infrastructure on kind of getting rid of the stupid stuff, that efficiency of work, and kind of really improving that efficiency of work and having that part of that well-being. Part of our strategic plan was also enhancing that mental behavioral health support and really looking at what are ways we can kind of foster that for both our care team members and their families, and then really kind of supporting leader work. Like, how do we support our leaders in this space? How do we elevate well-being as an important part of leader work, and making sure that we're providing leaders with that support. So those were sort of, all the data we gathered was sort of the building blocks to be able to support that, our current strategic plan in this space. I mean, we're still building it, and we're implementing and building it as we go.
That's fantastic. So
Whitney and
sorry. I was just going to ask.
Go ahead, Emily.
When you look at all the investments that MUSC has made over the last 3 years in that organizational culture change, what are the key metrics that you're tracking to evaluate success? And how are you proving to stakeholders that the investment in the human experience really yields that true value on investment, not just in terms of dollars, but also in terms of the human impact and the long-term health of your workforce and your organization? And are there any preliminary findings from your evaluation efforts that you would be able to share with our listeners on outcomes that you've seen?
Yeah, I mean, we had our own sort of metrics we were looking at with our pilot units as we were building and growing this, which is slightly different from some of the metrics, the bigger metrics I think our strategic plan is looking at, which is a little bit broader. But, we were looking at professional fulfillment. So we re-implemented, your survey to just our units to kind of gather a little bit more information about what that burnout professional fulfillment looks like, showing that there was some shifts and changes and increase in professional fulfillment, which is really exciting. We were looked at, I know, yes, and such a short period of time to be honest, because things we're still developing and growing our programs. And so to see such shift, I think to show that to me that's also demonstrating like culture shifting, and that's shifting pretty quickly. And then I'm also seeing some our Press Ganey ratings for some of our units. We intentionally chose units that were kind of in a tier 3 range, which is indicating that they're kind of having some struggles, and a significant shift in the majority so that they're either in tier 2 or tier 1, which is really fantastic. And then one other piece of data that we found is that we looked at patient satisfaction ratings from those units and found an increase in patient satisfaction, which I think is huge, right? So it's not just impacting our healthcare workforce, but it's impacting the care that patients experience that they're having. And so I think that, that is such a huge return on investment to pay attention to. So those are some of the initial findings that we found just in our units. I know on a larger picture, we're some of our metrics are, number of people trained in stress first aid, and then who's implementing it, and what are people's response to that and satisfaction to some of that, to our peer support program that we're initiating. And then just looking at some of, not only the Press Ganey overall engagement scores, but then just looking at other sort of things, looking at, utilization of sick leave and PTO, and looking at policy changes. Yeah. Just looking at some of those other pieces that we know well-being can impact.
Yeah. So people are like utilizing and feel safer utilizing PTO more now. They feel like there is more support and knowledge about well-being, and it's more services, and that just being able to openly discuss things in help-seeking behaviors, that all of those are improved, which is, I think that's huge. And I think that's the culture piece that we've been hoping to change.
Thank you.
Definitely.
Thanks.
It's been really lovely kind of collaborating with you all. I mean, you all kind of have had a lot of framework of some directions that folks can go with. And what we just did is like took some of that framework and some of those recommendations and, what does that look like when we implement it, and what are people's response? So it's really been a wonderful partnership with South Carolina Hospital Association on on applying some of those approaches and strategies in real world settings.
Yeah, totally agree. And I think it's just looking back on this too, it's not that, yes, we built on some existing programs and built new programs, but these are things that anybody could do anywhere. And I think that that's a big lesson to take from this is that, doing a listening tour, it does not have to be as detailed or as, research focused, but just taking the time to listen and feedback and, build a peer support program, build on your EAP or have an in-house team that can respond to stressful events is, I think we've learned has been really, really impactful. But Emily and Jen, I mean, it's been lovely. I think I've said this so many times. The last 3 years have been great. And I can't thank you guys enough for all of the collaboration and the rest of SCHA. It's been great. I wish everybody the best in future endeavors.
Thanks. Well, we feel exactly the same way. You guys have been such a joy and an inspiration. You're motivating to us. We love being the conduits to help you all share what you're doing, what you're seeing, your expertise with the rest of the membership of SCHA, as well as we know that we're having some connections in North Carolina now as well. And we just really love facilitating those types of relationships. So Whitney and Alyssa, we're about to wrap up, but just want to ask if there's any maybe one thing. I know that's the most horrible question to ask, but if there's one thing that you would want our listeners to take away from your work, what would that be? Whether it's a inspiration to go forward, whether it's one thing like you got to have this one thing to be impactful. What do you think that might be?
I think perseverance in this space is really important, and that, it takes time, and there isn't just a one and done. Like, what worries me sometimes is I know there's some great resources and great entities out there that exist that can help step in and help help health systems in the well-being space, but it's really not something you just like plop in a cookie cutter approach. Like, really taking the time to listen and to hear from folks is really important. Being intentional in that and knowing that it's an iterative process. For me, it's kind of, you need some perseverance. It takes time. And at the same time, it is totally doable. Like, I'm just floored, to be honest, by the significant change that has occurred in our institution in such a short period of time in such a positive way. And so it can be done. And there are some great resources out there that exist. And to support people through those efforts. So I guess that would be kind of my thoughts, that take the time, listen, and know that it can be done.
Yeah. I think just don't lose hope. I think I have been in this space for the better part of my whole attending career, which has been almost a decade. And most of it has not been like funded or supported, but you just kind of follow people's passion and let people know that that's where you're interested in, and just kind of keep, collaborating with the people that you find joy in and that have, like-minded efforts. And it's an exciting time right now in this space. And I think it's going to continue to grow and flourish and only make, I think, our workforce stronger.
Absolutely. For sure.
Yeah.
So we're going to, SCHA is going to help you all share some of these really amazing insights in a more formal way here in the next few months. And so I want our listeners to know that we'll make sure that people know how to see a little bit more in depth some of the things that you all have been able to do and the impact that you've made. But I will ask, would it be okay with you all if we put some contact information for you in the episode notes? So if there's some specific things folks may want to reach out for, they can look there.
Absolutely.
All right. Awesome. That's one of the things we love about you all and MUSC in general is how willing you are to share both the good and the lessons learned. It really does help elevate the tide. So thank you both so much for telling us why and for the incredible rigor you're bringing to the workforce experience. Thank you to the Duke Endowment for their commitment and ongoing investment in the healthcare workforce, and to MUSC's leadership for your vision and continuing commitment to really uplift not only your own institution and your system, but everyone that you come in contact with. So I think for me, the key takeaways today, there's so many, but off the top of my head here, I'm thinking culture and operations are two sides of the coin. You need to really have something that focuses on both pieces, that listening is truly an impactful, high-level strategic intervention, and that leadership's willingness to truly hear and invest in doing things differently is critical. So we hope our listeners agree that this has been an incredibly insightful conversation. One of my focus values, going back to what Alyssa said for this year, is gratitude. So to my co-host, Emily, this has been an incredible run, and I'm so grateful for our teamwork and our friendship over the years. To our audience, thank you for listening. To those who want to know more about the Y Initiative and the work being done to create fulfilling workforce experiences, you can visit scy.org. If you listen to this episode, please, and you like it, please leave a review, share it with your colleagues, follow the show so you never miss an upcoming episode. So to everyone, thank you for listening.